Don't let cyber threats put your hospital at risk. The number of cybersecurity attacks on healthcare organizations is growing, and patient care is on the line. At the Rubrik Healthcare Summit, you'll get actionable insights from thought leaders like John Rigi, the National Advisor for Cybersecurity and Risk at the American Hospital Association, on how to protect your organization from the latest threats. Join the Rubrik Healthcare Summit on September 10th and learn how to prepare for, respond to, and recover from cyber attacks. Register at events.rubrik.com/healthcare. That's events.rubrik.com/healthcare. Today on UnHack the News.
The faster we cross-pollinate, the faster we as vendors, customers, providers, practitioners, lawyers, whatever, can come to this is how to solve this problem.
Hi, I'm Drex DeFord, a recovering healthcare CIO and longtime cyber advisor and strategist for some of the world's most innovative cybersecurity companies. Now I'm president of This Week Health's 229 Cyber and Risk community. And this is UnHack the News, a mostly plain English, mostly non-technical show covering the latest and most important security news stories. And now, this episode of UnHack the News. Hey everyone, it's Drex. Welcome to UnHack the News. I have Josh with me today. Hey, Josh.
It's nice to be with you, Drex. Good to see you again.
I'm glad you're here. This is, I think, the first time that we've had you or Rubrik on UnHack the News. So why don't you give me a little bit about your background? We were talking before we started the show. It's really interesting. Tell me a little bit about your background. Tell me a little bit about the work you're doing now with Rubrik.
A little bit about my background. I've worked in IT since I was 15, a couple different countries, came back to the US. My parents worked for nonprofits overseas and went to college, joined the Army. Army sent me to Washington. Turns out you and I live pretty close to each other in terms of the geography of the US, and worked for a bunch of different organizations before jumping over to the dark side and helping vendors sell stuff. And so today I try and be helpful to all of our healthcare customers. So a lot of different organizations across the country, and I spend a lot of time talking with them about cyber resilience, understanding what's happening at some of their sister organizations, and the emerging body of knowledge about how industry and practitioners are coming together to try and address the scourge that's racking IT these days. So I feel like I have a wonderful job in that I just get paid to go and have interesting conversations and meet interesting people. Tony Lakin at UTSW and Brad Busick at Multicare and all these interesting folks that it's fun to hang out with. So I feel really fortunate.
I feel like that you and I have the same text buddies. Yeah, we're super lucky, right? To be able to work in healthcare. It's a great mission, patients and families, all the good things. Josh is super humble. If you get a chance to sit down with Josh and have a conversation, he's not somebody who's going to run you over, but ask you a lot of good questions and share a lot of stuff that he knows. And I know that you won't say that, so I'll say it for you. I always have a great time. Every time we sit down and have a chat, I always come away smarter. So
the discussion's about hair advice, if nothing else. I've been trying to implement some of your tips.
We do what we can. Thanks for sharing some stories for us to hit on today. One of them's from Bleeping Computer. The heat wasn't just on the outside. Cyber attacks spiked in the summer of 2025. There's a bunch of bad guys that they cover in here, a few anyway. They talk about Quillen, they talk about Scattered Spider and Rysda and Interlock. The point of this whole story is really just about the way that the bad guys are just continuing to be relentless on healthcare. Tell me what you guys are seeing as you talk to health systems across the country.
It's difficult because we want to have empathy for the organizations we talk to, and we know that the fear is already there. Nobody needs to be convinced that this is a problem to take seriously and deal with. And every organization was already dealing with tight margins, budgetary cuts, and at the same time that we've seen cuts to rates and reimbursement, we're also seeing this just proliferation of threats. And there's a number of reasons for it. Is one, they're increasingly targeting places where we can't live without that service. So healthcare, it's critically important. Downtime can be measured in lives. And there is a massive litigation risk if data's breached. So there's a lot of organizations that we've talked to. We run this immersive ransomware experience that's a departure from the usual month in, month out tabletop thing. And we often get this debate about whether you're obligated to pay a ransom, because does it set you up for litigation risk later if you don't, if you can't prove that you've done everything you can? And yet we know that every time an organization pays a ransom, there is an increased odds they get hit again really quickly. I really feel for CISOs, CIOs, and security practitioners who are caught in this perfect storm of haves and have-nots. So like if you've got everything and you're all set, you're in a much better shape. And if you're trying to justify cybersecurity investments at this point, that's tough, right? So like there's a few trends. Dwell time seems to be decreasing. So it's
Right.
gone from a high number of days to weeks to, in some cases, a day or less.
I've
Much
seen
more of
some
a,
of the reports coming out of some of the organizations saying sometimes it's even just minutes, depending on how the bad guys set up and how they get in. They crack open the safe and start exfiltrating data within just minutes.
yeah. And then just the sheer creativity of how some of this is happening. I was reading an article about how they're targeting hypervisors and the control servers and using those to execute attacks against like virtualized domain controllers and exfiltrating the VMDKs or the VHD files so that then they can take their time brute forcing every single password to use to reestablish access after the recovery's been done. And it's just highlighting again how identity, if you were privileged enough to hear Eric Decker speak at HIMSS this past time, I sat there and just kind of put my head in my hands at some of what he was sharing. And we had a chance to talk again in Chicago. And he's an interesting guy. I think I'm supposed to talk to him this coming week about some stuff. But the announcements that we've made around Active Directory protection and identity resilience of like, how can we help spot some of these privilege escalation, or if people are changing like the Kerberos ticket granting token time to live, things like that, that are emerging indicators of an attack in progress. But unless you have the right tooling and telemetry to spot those things happening, in my previous career, when I was last responsible for Active Directory, I would have never noticed those things. I had so many other things to do. So it's kind of mind boggling. And there's always this tendency to think that the things that we have are the most important. And then I'm always coaching our sellers to like try and put themselves in the shoes of their customer and think about how what we do is one small part of the vast number of things that organization has to worry about, think about, that CISO, CIO, VP of infrastructure has on their plate in any given moment, just as a way of understanding how to approach them or be a good partner. So it's what's the curse? May you live in interesting times, right? Like,
And
I've
interestingly, I think that's a Chinese curse, if I'm not mistaken.
been so repeated that I don't know.
Well, so the other thing I think as I hear you talk about that, that I realize from time to time when I talk to leaders in healthcare IT is that sometimes there are members of the staff who have done things the way that they are doing them today. They've done them that way for a number of years. And so for them, that's what good looks like. And of course, they know the world is changing and the bad guys are getting better and faster and smarter and using AI and doing all of the things. But they keep looking at their same tool sets as this is how we're going to solve the problem by buying more of that or turning up the volume on it or something like that, instead of really sort of taking a step back. And I think this is I don't know if it's a culture thing. I think it might be a little bit of an ego thing that they can't take a step back and say, if I could empty out the entire shoebox, what would I really put in here now? It's hard for people to sort of put that aside. You see the same thing sometimes when you're talking to customers or when you're hearing from folks at many conferences that you go to.
I'm actually really glad you asked that question. It wasn't something you and I talked about discussing, but I have this like massive frustration, and I understand the value of RFPs. I understand why we do them, but boy, does it frustrate me when we get an RFP that feels like it was written in the late 1990s.
Yeah.
Just all about data protection, like the traditional classical, can you restore an individual file? And I'm like, everybody should be able to do that by now. And it doesn't ask any of the questions about the new set of capabilities.
Yes.
I mean, that's human nature, right? So, like, we still call these things phones, even though that may be the thing that we spend the least time doing on them. But that was the mental box that we had, so we replaced the phone with this thing, and now it has all these new capabilities, but we still think of it as a phone, right?
Right. Right.
And so we'll get these massive RFPs that have like a week and a half turnaround time that require all of this work to put together that aren't really even answering good questions, right? And so sometimes I just offer people, I'm like, look, I have a list of the new required capabilities. They're not in Rubrik terms, like use it or don't, whatever. But yeah, there is a new set of tooling, and it's actually something I'm kind of fascinated with, is there's the things we are talking to organizations about, the importance of having downtime procedures, of identifying the minimum viable hospital, of critical
Hmm.
applications, of understanding that DR measures won't save you because what you're really struggling with is this loss of trust. So if you want to get back online in a reasonable amount of time while the forensic investigation and remediation is happening to regain trust, then you're going to need an isolated recovery environment. And once you arrive at that, then the needs that you have around data protection and the tooling are completely different. Well,
Hmm.
not completely, but when it comes to recovering from these attacks, what you don't restore is as important as restoring important data. And that if you contaminate that and introduce malware, you get to start all over again. And so,
And you see, that's why sometimes these things take 30, 40, 50, 100 days for people to recover from, because they keep
yeah,
shooting themselves in the foot as they go through this restoration process, and they have to go back to the beginning and clean up and restore. So having IRE, having understanding, have this clean environment to start, kind of a huge deal.
it is. And this is what I'm fascinated with is like how we, as a vertical, an industry, a sector, as a society, we come to develop this body of knowledge together. In that a health system that gets hit, they responded to their attack, but it was very specific to them. So, how do we take the lessons from that, get them out from behind the lawyers who don't want to talk about what
Right.
happened, share them broadly? So, Ardent Health, their leadership, Annika and Lonnie, the CIO and CISO, I think I'm supposed to talk to Lonnie tomorrow. They got up at Chimefall Forum and were very transparent. Not a Rubrik customer. I'm just so grateful to them for having the courage and for having worked with their legal team to get permission to share broadly. This is what happened. This is what it looked like. Here's what we dealt with. Here's what we were unprepared for. These are the takeaways. If you do a few things, do these well, right? I've heard other CIOs behind closed doors say, don't quote me. I don't want my name attached to this, but here's what I would want to have everybody know. And so I really admired them for sharing, the Ardent Health folks. So we take that knowledge and then we try and build it into products, right? And then we try and convince everybody that's the right way to do it. And sometimes we're wrong and we have to go back to the drawing board, but there is this emerging body of knowledge, like organizations like HealthLink Advisors. When I talk with them about their blackout blueprint and how they define downtime processes and build this set of minimum viable hospital applications. And then we talk with Mandiant and others is like, we're slowly kind of arriving at here's how you address this in a
Hmm.
practical, repeatable, tested way, right? So that's just something that I spend a lot of time thinking about is like, how as we as an industry can do more knowledge sharing in the wake of what's a very sensitive event.
I mean, not to toot our own horn, but it's a big part of what we do with the 229 project and the CISO
Right.
summits is that when you get those people in the room, they will talk plainly and clearly to each other,
Yeah.
even though they will from time to time say, this is just between us, right? But that's the whole point is that you can get it off your chest. You're not alone. You can get feedback from others in the room. And for the partners who are in the room, there's a lot of great sort of insights about how the whole situation came about and where they made mistakes, going through the process to recover and getting back on their feet. There's nothing else like it. That's why
Mhm.
I'm kind of involved with this, but there's nothing else like it. I love the way that these guys and ladies will just kind of unload on each other because it's okay to be vulnerable. And that
Yeah.
isn't the rest of the world that we live in. Like you said, everybody lawyers up. The instant that it smells at all like maybe there's a breach going on, minutes later, there's a class action lawsuit that's been filed. All those things that happen that are counterproductive in a lot of ways. It keeps everybody's mouth shut when they should be talking to each other. Other
Yeah.
great organizations too, the Healthcare ISAC, Health Sector Coordinating Council, all about trying to help folks share information and do better, especially in the heat of the battle when something's going on.
Yeah, I like the Chatham House rules format that you guys have. And in fact, as an example of this, I first heard about attestation at one of your events. One of your CIOs shared and said, this was a huge problem. And I furiously jotted it down and went back to our product team and we talked about, is there a way we could help? And then later we heard Ardent Health when they presented talk about the same problem. So we actually took a lap with a couple vendors who we don't compete. And so we started thinking about like, how could we give the lawyers better grounds on which to write those attestation letters much earlier in the process and restore some of those services that have been cut off out of an abundance of caution.
Sure.
So it's interesting. The faster we cross-pollinate, the faster we, as vendors, customers, providers, practitioners, lawyers, whatever, can come to this is how to solve this problem, right?
Yeah. And get systems back up and running for patients and families.
Right.
That's ultimately what resilience is all about.
Yeah. Drex, you said earlier I wouldn't toot my own horn, but I'm going to now.
Okay, good.
My team and I think we know more about quantifying the financial impacts of ransomware attacks and data breaches in healthcare than anything else I've seen. So we have consumed every study we can and built the most detailed model that I know of. And it's really fascinating when you start to apply facts like you're looking at a 20 to 40% decline in patient volumes the first week after the encryption event. And that's just top line, right? There's going to be increased rev cycle leakage for the patients that you do treat. And the care that you do provide will be less thorough. You're going to order fewer tests, order less labs, et cetera, because the increased friction of that.
They're going to be less well documented, so
Right.
you're not going to pay as much for them. Yep.
And then the coding will happen later on insufficient notes that were taken by hand, and then the billing may be late, so reimbursement and denials will be affected and so forth. And the chain of events keeps propagating. According to Deloitte, they wrote this really prescient white paper beneath the surface of a ransomware attack, and it was a number of years ago. I wish I had a hand in it because it's really well done. But it talks about these 14 categories of costs that every ransomware and data breach have. And the work that we've done in this model we built isn't trying to convince anybody of a number, but when you go through and you put some number in every category, you quickly start to realize like this is a board level discussion. This is a existential threat to a number of organizations. So I know, and it's public and it's been for a while, so we can talk about it, but like there was an article, SMP Health publicly said that ransomware attack was the nail in the coffin. The bill for 3 months down. And so there's all of these facts and statistics, like there's a 30% increase in medical errors. Mortality takes a quote, slight but significant increase from 3 in 100 to 4 in 100 patients, which you could look at as small, or you could say that's a 28% increase.
I'm the one.
Yeah. And the 28% came from a different study. That math doesn't math. But when you start to apply these things and you think, okay, then that is a 30% increase in the rate of settlements that we'll pay over businesses. And then you get to like the tertiary downstream effects of increased cost to raise capital, brand devaluation, on and on. One of the things that always people ask me about when I walk them through the math line by line is that the notification costs can dwarf the actual class action settlement.
Right.
And people think they think in terms of the large numbers that are attached to the settlement, right? But they don't think about how in the immediate wake of an incident, the lawyers are asking who was affected, how many records, who do we have to notify? And if you get that part wrong, and later you have to go back and, well, you've already spent $3 per person minimum to notify them, and that can be 2 to 3 times what you spend in the class action settlement, right?
And
so
the reality too, for the notification process, I think most organizations are they work that conservatively. So their tendency is to over notify. So right out of the gate, they're probably spending more money than they need to because they don't really know what happened in many cases.
Right. Yeah. And not to talk about us, but like that's one of the things that we're saying, like if you can determine not the sensitive records that were on that server now, but what was on there 30 days ago when this happened, what changed right around that time, anything you can do to constrain that list and be as accurate as possible rapidly starts to constrain the overall costs of the data breach, the litigation, the eventual class action settlement, et cetera. Actually, I'm going to put out an appeal, if it's okay with you. If there's anybody who's works in FP&A or a CFO for IT who is willing to answer some questions, we're constantly working to improve our model to flesh out other categories around like cyber insurance. We know things like there's a 67% increase in marketing and public relations costs in the wake of a ransomware incident and data breach. Well, that's an interesting factoid, but when I have no idea what that cost looks like for normal business, I can't estimate it, right? So we have been on a tear for a while now, trying to give the organizations we work with the best look at this is the risk number, right? Because any investment in cybersecurity, whether it's something related to Rubrik or it's perimeter security or IDS, IPS, MFA, what have you, right? Managed SOC, you have to start with what is the risk that we're mitigating? Is this warranted, right? And the white paper from Deloitte, their whole point was that these costs and impacts are being systematically underestimated. We are drawn naturally to the headlines, which are usually about the ransom, the data breach, whatever, but there's actually these factors that play out over a decade, that it takes a decade for the financial impacts to all settle out. And when you aggregate those, it's an eye-watering number. So anybody who's willing to just answer some questions off the record, I'd be so grateful.
Well, I'd love to do that. If you send me the link to the Deloitte paper, I'll make sure we also
Sure.
put it in the notes. And I'm sitting here thinking, I feel like we should do another show somewhere down the road where we actually maybe walk through some of the math that you
Happy to do
guys
it.
do. Because you don't have to be a Rubrik customer to walk through that math with you, right? You'll help
Nope.
anybody kind of think through that process.
Yeah. Give me a call. We'll get on a Zoom and I'll punch in some numbers and you can help me fill in some others and I'll share the results with you. So again, like I've been on all sides of the table. I've been a customer. I've ran a channel partner. I've been at a vendor a number of times, and I think develop empathy for those other roles, and you just want to be a
Sure.
good partner and give something of value back to the organizations you call on. So happy to do it.
I think it's a great idea. The reality is what you're doing is helping cyber leaders build the business plan to support their argument to spend money for cybersecurity and resilience. And that's hard math, but it's math. You just have to figure out what numbers you want to stand on. And some of it is just, I think, getting started. So it's cool that you're doing that.
Yeah, well, it's a fun job. Like I said, I think I have the best, coolest job in the world. So.
No, I got the coolest job in the world, but you're, you're close second. Hey, thanks for being on today. I really appreciate it. Sometimes we really get into the news and sometimes we go down a side path, and I love the side path today. So thanks for taking me on the trip.
Yeah, of course. Thanks for having me, and apologies for going off on a weird tangent, but if we can help in some way, we'd love to, and maybe this is one of those ways.
Thanks for tuning in to UnHack the News. And while this show keeps you updated on the biggest stories, we also try to provide some context and even opinions on the latest developments. And now there's another way for you to stay ahead. Subscribe to our daily insights email. What you'll get is expertly curated health IT news straight to your inbox, ensuring you never miss a beat. Sign up at thisweekhealth.com/news. I'm your host, Rex DeFord. Thanks for spending some time with me today. And that's it for UnHack the News. As always, stay a little paranoid, and I'll see you around campus.